everybody. Welcome back to another episode of Honestly Bilal. I'm your host, Bilal Med, and I'm a fourth-year medical student at the University of Toledo. And this is Honestly Bilal, the show for the aspiring ophthalmologist, where I sit down and talk to medical students interested in ophthalmology, residents training in ophthalmology, and current ophthalmologists in the field today. My guest today is Dr. Nimesh Patel. Dr. Patel did his medical school at Tufts University, followed by his residency and fellowship at the Bascom Palmer Eye Institute at the University of Miami. And he'll be starting as an assistant professor of ophthalmology at the Harvard Medical School's Mass Eye and Ear Institute. So Dr. Patel, thanks for joining me. It's kind of crazy how things collide in the world, and we got to know each other through a little bit of Instagram and text messaging. So here we are today, and really appreciate you being my guest.
Yeah, no, thank you so much for having me. And I really think that you're doing a great job with this effort and initiative. And I think it's a group that really hasn't been talked to much, medical students applying into ophthalmology. I think we all got a lot of help along the way, but we had to search it out. And it's really nice to have this opportunity for medical students to watch these type of shows on social media and on their phone and really get some info that way.
Yeah, absolutely. So, and I know that your journey is evolving right now, and I want to get your story here. So let's talk about what got you into ophthalmology, what drew your interest in the field, and then after that, even what drew you into vitreoretinal surgery.
Yeah, so everyone has a very different story. Mine was a little bit of luck. At Tufts University, they have what's called a selective where you can shadow, and it's a little bit of a lottery system. I think I had signed up for cardiology, and that was full, and they said you can either try again next semester or ophthalmology is available. I said, okay, I'll try ophthalmology. We'll give it a shot. And I was completely surprised at what ophthalmologists do. I honestly didn't even know at that time the difference between ophthalmology and optometry.
Right.
And I was with Dr. Krishnan at Tufts, who was the program director. He's a really nice guy. And I think that's a common theme for people why they choose a profession. It usually starts with a single mentor. He got me up into the operating room. He gave me a research project. And I was very surprised when the patients came back, how happy they were. And that was a little bit of a contrast to some of my ward rotations where we didn't really feel that same connection that we were making as much of a difference as you could in ophthalmology. I wavered off a little bit more wanting to do general surgery into my third and fourth year, but I came back around after being on that general surgery rotation. I liked it, but then I realized it wasn't giving that quite the same fulfillment I had found on the ophthalmology rotations. And I also had done a international elective going to India where we went to a variety of different subspecialties. And I think seeing the ophthalmology there and seeing the global breadth of eye disease and the impact it can have, I was sold at that point.
Nice. And then what got you into vitreoretinal surgery and along that route?
So vitreoretinal surgery, it's challenging to choose a specialty in ophthalmology. You think you're done when you've chosen ophthalmology, and all the subspecialties are very different.
Sure.
I liked retina surgery because the thought that you can operate all over the eye. I like the thought that if you have an issue with cataracts, you can go to the back of the eye and fix it. I also found when I was watching a lot of surgery initially in retina that no two cases were the same. Each retinal detachment is very different. Each membrane is different. The vitreous is different in each patient. So I found that there was a little bit more art to it than I had initially thought, and it wasn't really as mechanical. There was a lot of thinking involved. So that's what initially drew me, and it's been everything I had hoped for in that respect. So that was part of it. The other reason, is part of the Bascom culture. A lot of people go into retina, and I think probably that had some influences on my people that I looked up to at Bascom. They were all in retina, and they, quietly pushing me into retina. I probably didn't even know it, but that's part of it too. Again, just like ophthalmology, you find some good mentors and some good role models, and that's where they are, and that's where you find yourself.
Absolutely, yeah. And a large part of being down there at Bascom is, part of you're transitioning to the attending role, and then part of being an attending and looking is the job hunt. So how's that transition been for you from going from fellow to attending, or looking for jobs and being an attending? And I know there's maybe some trainees out there who may be listening in. I know this is geared towards the medical student audience, this show is, but maybe some residents or even fellows are listening in and want to hear about your experience. So talk about that if you can.
Yeah, I think the job search is very different than how we approach residency and fellowship, which are more match. it almost makes you hope for that match again, even though I'm sure for the medical students listening, they're probably thinking, oh, the match is the worst thing ever. But in some ways, the job search is a little bit different. It's more like it is maybe in finance and things like that, where yes, there are job postings and yes, you apply, but they come more of on a rolling basis. There's not really a timeline for them. And not all of them are advertised. Initially, you may hear about them through your mentors, through your classmates, through, at a meeting. So
Right.
I found that it was a little bit more tricky navigating that. But I think the advantage of going to these programs and really trying to find a residency that fits you well and a culture is, especially in Bascom, there's a big network. And a lot of the job interviews I got were either through that network or through them introducing me to other people. And I interviewed at both private practice and academics. And I really encourage everybody to do that, including interviewing at maybe locations I wouldn't have thought about going to in terms of parts of the country.
Sure.
I think there's a lot of differences in the jobs. If a place has a certain need, maybe they'll be more wanting to be able to give you a little bit more in terms of what you're looking for. While also some of these cities that I didn't think were all that going to offer a lot for me and my wife, they've changed a lot. They've lots of restaurants, lots of things to do. And so I really encourage people to think broadly. There's no harm in going. And you'll find that you might learn something from one program and said, oh, maybe my future job, I could even implement that. And it's not something they had there. So I think it's a little bit of a challenging process because it's not as structured, but I think having an open mind, being willing to go to private practices, academics, all parts of the country, really give you a good sense of where you may even want to end up.
Very cool. Yeah, it's just I think it's one of those things where it seems like from what I'm hearing from you, just being open to different ideas and experiences and different places. So maybe it's good to step outside your comfort zone sometimes and just try different things and new things. So, and along that route, something that you've done while you've been at Bascom Palmer is you actually helped implement the Instagram page of Bascom Palmer that's run by that's showing some of the residents and fellows and what they're doing on a day-to-day basis, cool cases, conferences. So talk about how that idea came to fruition and how it happened.
Yeah, so the Instagram account is called, it's Bascom Palmer Eye for anybody who wants to follow it. But it was actually initially Dr. Alkersan's idea. He was 3 years below me in training at Bascom, and he had said, we really should have this, and what do you think? And at the same time, I was actually working on an image bank and a video portal with the marketing and the CME department. And I said, yeah, for sure, and just go ask the chair. And that's what I did for when I was starting the image bank and the video portal. And like yourself with this effort, I think if you have an idea and you think it's something that's good, I encourage everybody just to go for it. And the worst that someone can say is no.
Sure.
And, I credit Dr. Alfonso, our marketing department, CME department, who were willing to actually let this happen. It's not very uncommon to have a institutional account that's really run by residents and fellows.
Yeah.
So I give them full credit for that. But he basically went in, Dr. Alfonso said, yes, this is a great idea. And then him and me together have basically been running it. It's been really a lot of fun to do and I think you've had Dr. Tooley on the show before, and she mentioned that the community online is really large. And I was floored with how many people would want this content and interact with it and learn a lot from it. It's really staggering how many people can see a post. It's even more than at a meeting. So That's been a lot of fun. It's also been learning for us we initially started it as to show off the residency, how everybody gets along. We thought applicants might want to see our culture and see it. And then we realized a lot what people like to see in the ophthalmology and optometry community are education and cases that may be simple for us as a third-year resident or a fellow. There's a lot of people out there who are still learning, and they want that information. They want those quizzes that they can get on their phone. It's just the way the new generation is learning. So it's been an evolution for the account, ourselves, and the institution, and they've been very supportive.
Yeah, it's such a great platform just to really, in a time like this where we're learning so much about how to really cross connect with each other, communicate with each other. I think for the educational aspect of it that you're talking about, it's such a huge potential opportunity for, a place like Bascom Palmer to really show, unique things that are happening down there with cases that you're seeing, and also, that idea to learn from other places too, across the country or even across the world. So kudos to you guys for doing that. It's a very well run account, and it's already have so many followers. So if you're not following Bascom Palmer Eye, definitely follow them on Instagram, and check out the stuff that's going on the page. And
Yeah, and I also I learned a lot being on there because we end up following a lot of other ophthalmology accounts and yourself,
thank you.
and it's amazing the amount of great cases that come along. We even have a text chain that sometimes I'll send out cases from there, and no one has ever seen it, and
Wow.
it just shows you that there are cases that you may never see, and you may only see once or twice, and they're in different parts of the globe, but with this platform, they can all go in one place.
Yeah, it's so exciting. I mean, this is a kind of things that I think are silver linings from obviously this pandemic, is that we are recognizing the ability to connect through these initiatives and without ever being in the same place. So very cool, very exciting to see how it continues to grow and evolve. And all the best in that initiative, and with everyone who's running that. So one thing that you just mentioned were you mentioned some surgical videos, and one thing that you and I had talked about is something that a piece of advice you want to give to people who are in training is something involving the recordings of surgeries and how to really view them and learn from them. So talk about what is your pearl of wisdom when it comes to reviewing surgical cases, and what you like for residents and fellows to really think about when they're in that when they're pursuing those learning opportunities.
Yeah, I think we are very lucky to be in a time when technology is evolving. I think first having the electronic medical record was great, being able to catalog all your cases. You can go back and look at the imaging later. They're not in files. And that was step one. And I think the step two evolution has been the video recording equipment in the operating room. It's HD quality, it's crystal clear, it's fast downloads, and then also the editing software on Macs or PCs, whatever you use, is very easy to learn. And I encourage, if I always said if I could go back to day one, the one thing I would change is keeping track of all the interesting cases I saw, writing down the MRNs, keeping a list. I started doing it as I went through, but it would have been really nice to do ahead of time, because you never know what is reportable. Maybe you see a couple of those similar cases, you can write them up. As for the video recording, you never know what can happen during a surgery. So what I suggest is recording every case, and then, just at the end of the day, only downloading the interesting ones. But
Sure.
you might have an interesting thing happen, you may have a complication, and it's really nice to be able to go back and look at that and see why it occurred. You'll also find when you're learning to be a little bit more efficient in the OR, you can't quite figure out why you're slower than your attendings or your fellows. And sometimes when you watch these videos, it's very painfully obvious. You're watching it and you almost think you haven't clicked play yet. And you're sitting there with the paracentesis blade ready to go in the eye, and you say, oh, why isn't this video working?
Right,
And then
yeah.
you realize you were just paused yourself.
Sure.
And then there's that feedback, and you can think to yourself, okay, when I start the case, I just need to go for it and start ahead of time. The other major benefit is all the major retina meetings are starting to include surgical videos as presentations. So, you may not be a bench researcher, you may not be a statistician or a clinical researcher, but if you like videos and video editing and surgery, it's another way to get yourself out there, show interesting cases, be on the podium, and that's another really big benefit of keeping these cases in backlog.
Very cool. Yeah, and then there's the societies like the Vit Buckle Society where they talk about interesting cases, and I believe fellows or trainees can even submit their videos to these kind of forums. So again, it's really interesting seeing how technology is evolving, not for only ourselves to look at how we can improve, but also to how we can improve people's educational opportunities across the world. So very good advice. Hopefully I have a chance to not only do surgery, but also record mine and learn from, I'm sure the learning curve is crazy huge. So but it's like sports, and I've had this conversation with a prior guest, Arjun Watan, who's down in Miami, and we talked about how, like, even the sports, people will watch tape recordings of themselves again to see what they're doing and how they can do it better. And in a skill like surgery, I'm sure that is so beneficial. So Yeah, thanks for sharing that pearl of advice, and looking for any others you have. And one of other pearl advice that you and I had talked about before we got on here is something that you wanted to really tell people who are applying this year for residency about the interview process. So I know you have some advice about how to think about the interview process and how applicants should see it when they go into that process. So why don't you talk about how I know you've been part of the selection committee at Bascom Palmer in the past as a chief resident. So talk about what it's like to be on that side of things and what applicants should know.
Yeah, this is a very stressful time, once you've sent in your applications. I think it even starts a little bit before then, where I would say the whole application comes up very fast. I found, when I wasn't really sure yet, and suddenly deciding in fourth year, I think the biggest rate limiting step is getting letters of recommendation. So for your second and third year residents or students who are watching this, I think as going forward, just start thinking about who can write you a letter. And generally the good letters are the personal ones, someone who can write you something where they really know you. And that takes a little bit of time. Maybe you've done a research project with them. Maybe you've been going to their clinic for a while. So I think it's just good to start thinking about that part of the application. I think that's the most challenging. And of course, there's publications and things like that. But I think getting some nice letters, and that builds a lot of time. I think also, again, just like the job application process, I encourage people to apply broadly. And you never know what a program will be like. There's a couple of programs I added at the last second that ended up 2, 3, 4 on my rank list, and wow. they were number 55 that got added later. You just go to a program, you may feel the culture is good for you. You might have not known about it because it's not on the US News rankings, but when you talk to the residents and you see how much surgery they're doing, it's much better than what you may have known or what your mentors may have told you. So applying broadly. Plus, I think being on the other side and reviewing applications, you see that they're very similar, and it's very difficult to choose. I think I feel bad for those people who are those ones who have to review the applications and hand out the interviews, because everybody's so good and you're splitting hairs. When with that happens in the process is you may not get interviews that you're expecting, and then you may get interviews that you weren't expecting. So, and they're not necessarily geographically based. I didn't get as many interviews, which I thought I might get in the Northeast where I went to medical school. And then I got a few interviews on the West Coast and in Miami and in Atlanta. So those were not places I was really thinking I would get as many interviews. So it's hard to say. So again, just applying broadly, having an open mind, going there and seeing what it's like is key. And then once you get there, and I've been told this 100 times and I didn't really believe it, I think it is true, and it's definitely true at Bascom's for the most part. Once you arrive on the interview, you are on a fairly level playing field. And if you've gotten to that point, it means that you're generally acceptable from an academic standpoint. So at that point, they're really looking for fit of the personality, but also just nice people. And it's really hard, but I think practice interviewing and just being yourself, saying what you like to do, having conversations on the interviews, I think are good.
Sure.
Don't let it be just a one-way street where they're asking you questions and you're answering them. Feel free to open up, ask questions. I think even having some questions in the back of your mind beforehand is very good. So you can get to know the faculty. You'll start seeing what they like, what they expect in residents, what they expect in fellows, and that will help you also judge if you're a good fit for the program. And then I think when you're deciding on a program, I think culture and fit is very important. So everyone is always kind of caught up on going to the best program with the best training or the best name. And I think if you go to a program that you're a good fit, it will help you be the best version of yourself. And, if you are happy in that location, if you're happy with the culture, if you're happy with the learning style. So the one that comes up a lot is autonomy versus basically more of a hand-holding program. Right. If you're somebody who doesn't really like to get out there on their own, wants to be a little bit more stepwise approach, then being at one of those programs is better for you. And if you're someone who says, I've seen it a couple times, I want to try it. Sure, I'm going to be supervised, but I want to have the ability to try something. I want to have the ability to do something. Then those programs are better for you, and that's when you'll grow, you'll be happy, and then you'll be able to really thrive.
Yeah. So it seems like you just, at the end of the day, being your authentic self, being there and just being, it seems like that's always a running strategy. And I know I mean, for me, obviously as a student, it's obviously there's times of anxiety and it's nerve wracking to be like, oh my gosh, where am I going to go? Am I going to go, who's going to want me and stuff like that. So I think it's good to hear from your side of things that, trust yourself, trust what you bring to the table, trust the value that you can bring to the table, and then go somewhere that feels like it's a place where you will contribute something and can and be with people who you vibe with and can connect with. So that's always good to hear from the other side of things about how it goes. And
Yeah, and it's not the end of the line. So I think when I was applying for residency, I always thought, if I don't get in to vascular trauma, I'm gonna, it would be the worst thing ever. And it really would have been not great. And I loved my time there.
yeah,
But I realized that happens to a lot of people, and
yeah,
it doesn't stop there, because you see that if you work hard in residency, even maybe not at your top choice, you might get the fellowship that you want. And then someone
sure.
at a top program who maybe didn't thrive as well, they could be applying for the same fellowship later, and the person who did best in residency will get that fellowship. And
Right.
it's not the end of the road, and there's a long way to go. There's fellowship, and then there's even a job application after that. So even if you maybe have a disappointing match, it's hard, and it didn't happen to me, so I can't really say that for others. But from what I've seen in those people, is that it's not over, and you can still do your best, and you can still get to where you want to go from really most of the programs.
100%. Yeah, I think it's just something keeping back our minds that it's a journey, not a destination. So, Dr. Patel, I want to thank you so much for joining me. It's so nice to meet you and connect with you just over the past couple of days. So it's an honor to be with you, and best of luck to your continuing journey. Like I said, I guess there's no real destination, but the journey continues for you as well. And hopefully we stay in touch and can meet in the future someday.
All right, thank you so much. Thanks for having me.
All righty, bye-bye.